Hello everyone, we're going to get started. Welcome to Spreading the Word, How to Reach Audiences and Inspire Action. This is a webinar brought to you by the California Healthcare Foundation and its Opioid Safety Coalition Network. And it's presented by IE Communications. A bit of housekeeping before we get started. This session will be recorded. The slides and the recording will be posted within a week on the CHCF website at chcf.org/OSCN. All attendees will be muted for the duration of the presentation, but I do encourage you to participate and chime in, to ask a question or to provide a comment. If you have any logistical questions about the technical setup of the webinar, you're having trouble, use the chat function to the host. If you have a question for me, the speaker, use chat to all. And there is a survey and evaluation. Please take a moment at the end of the webinar to give us your feedback. And you'd think I could figure out how to advance the slides. There we go. Okay. And I am today's speaker. I'm Elizabeth Galicia. I am Vice President at IE Communications, a strategic communications and policy advocacy firm in Oakland, California. I'm also the Acting Communications Officer for the Opioid Safety Coalitions Network with the California Healthcare Foundation. Today's agenda. So we'll start out talking through what is communications for change, and work on outlining setting goals for communications strategy and for promotion and distribution of those communications tools, outlining key messages, messengers and methods, look at a range of sample tools, and also address any questions at the end. We'll have time for questions at the end, but I do encourage you that throughout, if you want to chime in the chat box with anything what's worked for you, what you find challenging, or any other commentary, I'm going to try to incorporate your thoughts throughout, and we can troubleshoot in real time. So communications for change. Communications can be used. What do we mean by communications for change? Communications is used every day for advertising, to get you to purchase products, or communications, particularly hot and heavy right now, can be used to convince you to vote for one or another elected official. Communications can be used to inspire you to donate to one cause or another. And so we want to think about, what does communications for change mean in the context of the opioid epidemic? For what, so what? What are we looking for? What is the change we're looking for? And rather than purchasing or grabbing your vote, it's really, we're looking for the kind of norms change and systems change that means that you need to be speaking directly to target audiences. So you want to figure out who you're targeting with your communications, and what are the messages that will resonate with them, that will really lead to a shift in behavior and a change in actions, culture, change in behavior, and a culture shift. So that's what we are after today. I think I might have gotten a question. I'm just checking. No, not at the moment. Okay. So when it comes to the opioid epidemic, not a day goes by where you don't see media coverage or a new announcement out of a new either policy shift or government announcement. We are tracking, as part of our work with the Opioid Safety Coalitions, media coverage of opioids locally, regionally, and nationally. And just over the last few months, you won't be surprised to hear that there's hundreds of articles. Coverage is regular, and people are, so that means there is growing awareness. People are hearing about opioid abuse. Does that necessarily translate into greater understanding and behavior change? Not necessarily. So do they understand the underlying causes? Do they understand what some of the potential solutions are? And are people motivated to act? That doesn't come as easily as I've read an article online or in a newspaper, and therefore I'm inspired. to affect change. When you have a complex issue like opioids, where anything having to do with addiction, there's a measure of stigma and apathy on the part of the general public. You also have competing crises going on, so you really need to both shift how people think about something and grab their attention. So what strategic communications gives you is it gives you the opportunity to combine data and evidence, so you're showing people, you're not just telling them it's a problem, you're showing them how, with storytelling, really that emotional pull to why it matters to them, why this is personal, why it affects their communities, and really that changing of hearts and minds. And that's what leads to action and behavior change. Okay, so we'll move into talking about process of as you're looking at setting some communications goals and distributing your work and the work you're doing at the coalition level and on this issue. So you want to start by setting goals. So you have, and we'll talk through that, you have broader goals and how they intersect with communications. You identify target audiences, you're creating messages and identifying messengers, and choosing the tactics and creating the tools and determining the timing effective to reach those audiences, and then evaluating, having an evaluation component. So setting goals, and I've been working as a communication in supporting coalitions for the past several months, and I've worked with a lot of you on outlining and realizing how communications can help you effectively reach some of your goals. And communication supports your policy and practice goals. At the end of your communication strategy, you want to see a reduction in opioid overdose deaths. You want to see increased naloxone access. And communications and your strategies and the materials you create and the audiences you're targeting directly relate to what your coalition goals are. And some of your goals, and feel free to pop into chat with other goals your coalition has outlined that are priority for you, where you're thinking about communications. Some of these they're measurable. There's data attached to them where you establish a baseline and then you see how effective you've been. When it comes to communications and with the changing of hearts and minds, there's fewer data points that you can point to. So you use things like, you can look at things like polling or survey data that shows changes in public opinion, or when it comes to, on here, decrease in addiction stigma. So it could be that through a media analysis of before and after, you look at how opioids are covered in the media, and then how that changes over time, what sort of language is being used, how pain is being referred to, those sorts of things. Okay. So you outline your goals, and you want to identify, according to those goals, who are your target audiences? What organizations or individuals are critical to your success? Now, at the coalition level, by very definition of your work, you're working with a range of audiences. And some of those you've engaged, some are harder to engage. If you have hard to reach audiences, who's priority in these audiences, and their priorities range. Local policymakers, board of supervisors, city councils, providers, pharmacists, law enforcement, public health workers, the broader community, which can include everyone from teenagers to veterans to chronic pain patients to family members of those who are addicted. And media. Media is another target audience, in particular for your communications goals. So once you identify your target audience, you want to understand the perspective they're coming from. So what is their current opinion of your coalition? Do they know about your coalition? Are you starting from the beginning, where you're really giving them the background on the coalition work and on opioid abuse in the community, or are they already an engaged stakeholder but not in not in the work and the progress building that you're engaged in at the coalition level. What are the barriers to their involvement or support? And think about, anticipate what some of the challenges may be or the pushback, and then you can incorporate those into your communications materials. Who do they respect? Identifying best messengers, and we'll talk a little bit more about messengers later on as well. Where do target audiences get their information? I mean, this is key to when you're thinking about distribution. What sort of outlets are you going to look for specific to your target audience? What events do they go to, and publications reach them? So it may be, where do they get information? News outlets. It used to be the funnel down to, the nightly news or to the networks, or very few news outlets was where anyone got their information. And now it's both a blessing and a challenge that people are getting their information from so many places, and there's information overload. So you want to figure out and be strategic about what are the specialty either publications or outlets or platforms where you'd be able to grab the attention of specific target audiences. And that's everything from traditional media to maybe it's on specific listservs or newsletters, or in grand rounds, or on Facebook, and different using different social media tools depending on the audience. So as you've identified who your target audiences are, you want to start thinking about key messages. And in working with the coalitions over the past several months, there's a range of overarching frames. And some of the frames, the coalition work is around opioid abuse is a community-wide epidemic that will require a community-wide response. And opioids are not a panacea for pain. Patients deserve better. This is kind of the aim, is at providers in the medical community there. And this is about helping you manage your pain safely and effectively. And that's really a consumer-focused message. So these are kind of broad frames where you can tailor messages to different specific audiences within those frames. So I'm going to run you through a range of tools that are different types of visual infographics, fact sheets, different strategies that you could use to present your information. Some we'll get into, and feel free to ask questions about, let's see, I have a couple coming in. Feel free to ask questions about we'll talk through when one type of strategy works a little better than another, and with which audience. Or if you have a specific audience that you'd like to reach, you say, well, what would resonate the most with this audience? Should I be, putting together an FAQ, or really is this infographics? So, so I have a question in, will this webinar specifically address coalitions for public policy advocacy? For example, advocacy at the national level for change. So the coalitions in the Opioid Safety Coalition Network are really working at the local level and looking to affect change at the local level. There's obviously efforts going on at the state and national level on opioid use, and the foundation is involved to agree, the California Healthcare Foundation is involved as well to agree on that policy advocacy. But this in particular, this webinar is really the changing hearts and minds, and how to impact change at that local level, and really to look at those target audiences. And there's another question. Oh, specific to, and you're asking, this is the same person asking whether changes to FDA policy. Yeah, we won't be getting into specific policy strategy in this webinar. We could probably create a separate one and a future one if there's a desire for that. So some of the sample tools, these are infographics and visuals that were created that can help you explain some of what can be just put in text form, and if you're talking about medication-assisted treatment, well, what does that really mean, and what is buprenorphine, and how can you have some visuals, or naltrexone, and have some visuals along with the text to really help people understand what you're talking about. Here's a opioid safety and how to use naloxone. There's brochures. There's a lot of materials that are available that can be adapted for coalition use, and that people can use and tailor to their own communities. And this is an example of showing data over time. And let's see. So now I'm going to move through a range of other materials and show how they could resonate with different audiences, how to get them out. So maps and Gifs. So if you want to show changes over time, obviously using maps, using charts, fever charts like this that are showing you how an epidemic has grown. It can be compelling, and these are things that you can, like the map at the top from 2004 to 2014, overdose deaths. Those we made in-house ourselves and have them available to counties, and this is data at the county level and also the state level that really can be compelling in terms of showing how over time it's not just affecting one area, but really is an epidemic and is really affecting everybody. The drug overdoses take more lives every year than traffic accidents. This is an animated chart out of the White House that's actually also for fair use. And we are collecting a range of fair use assets, whether they're infographics or maps or data that coalitions can use and repurpose and use in your own materials, and that's on our shared Google Drive. So this is an example of where you can discuss the particulars and the data around an epidemic, not in isolation, but having a comparison point. So for someone who's maybe new to the issue or doesn't quite understand how drug overdoses are affecting a community or affecting the country, this is a comparison point. So people are familiar with traffic accidents. They're familiar with where they're familiar with something more so than they may be with opioids. You can say, well, look at this, and in 2009, drug overdoses outpaced deaths from traffic accidents. So now I have the coalitions have been hard at work on a range of materials to help to educate their constituents and to further their goals of safer prescribing and increased naloxone use and medication-assisted treatment. And I have several slides, and I'll run through and talk through different elements of these tactics and who their target audiences are, and different distribution strategies and what's resonating and working about these. And I encourage you also to, if you want to chime in, and those of you who are on the phone who worked on these materials with comments, or others who have questions, who in the spirit of learning and wanting to share and perhaps create some of your own, we can talk through some of these materials here. So these 3 flyers, from 3 of the coalitions, we have 2 safe prescribing flyers on the left and right from Humboldt County and from Santa Clara, and those are the target audience. Someone just chatted in. These are aiming at patients. So these are posted in emergency departments, or in primary care clinics. And if you have patients coming in and you're telling them that this is for your safety, I mean, both of them say that, it's really addressing the patients. And it's outlining how pain management is changing, but it isn't about about not managing pain. It's not you have to live with your pain. It's about we're managing your pain differently, and how to follow these rules to treat your pain. And it's also really owning that that this has been something that has been part of an issue with the medical community, and how prescribing guidelines have been outlined before. So it's really taking that onus off the patient, that it's their fault that they've been taking these medications. I would say you can do things like, you have people who are walking by a flyer, or they're looking for something that'll catch their eye. So having the orange box, if you need help with a number, if you could also in the numbers bold a few lines that feels like, okay, I really want them to focus on this phrase. And the opioid facts in the middle from Mendocino County is also patient-facing, and does it bullets out some of the side effects, and then it asks, there's some constructs that really work that can draw people in, like, did you know if you take an opioid for more than 1 month, there's an increased risk you may stay on opioids for life. So that's that's a general evidence point. And then the second one is specific to Mendocino County. Mendocino County has 2 deaths from unintentional prescription opioid overdose each month, twice the California average. So if you live in Mendocino County, that this is speaking directly to you. So here we have Northern Sierra Opioid Safety Coalition. They're about their coalition, and this is a flyer that is urging people to get involved. So talking about the action teams, talking about the coalition. And we're used to seeing, I use this as an example, we're used to seeing opioid-related materials with, there's got to be a pill on there somewhere, or a prescription bottle, or a white coat. And this is speaking to the health and wellness of a community and a specific place, and to people who care about that place. So this is drawing them in and saying, this is where we live, and this is the community we care about, and please get involved. So it's sometimes okay you don't have to be as literal as whatever image I use has to be directly related to someone taking an opioid. You can also be specific to that place. On the right, we have Partnership Health Plan has released a naloxone toolkit aimed at providers, and this is an example where you could see a naloxone is effective and it being cost effective. There's plenty of text that could explain that. You could have paragraphs on the top and the bottom of this page, and instead it's almost all visuals, and it's really the data and infographics that are showing you that naloxone is effective and how it's been effective, and giving you examples. So that can be really compelling to sparingly use text and use visuals to show people, and to really show them how it's worked and how it's been effective. Okay. And I know I'm going through a lot of these. I'm happy to, I'm on calls with a lot of you as coalitions to talk through your materials, and if anything does jump out at you, or some of you will be listening to this on recording later on, definitely exploring some of these tactics and going more in depth, I'd be happy to do that. So newsletters and internal communications, emails, sending out regular emails or newsletters, being part of and contributing to listservs. It sometimes feels hard to be your own self-promoter, but you're doing a lot of great work, and you're inside the work, and you know it, but really it doesn't even have to be that you're creating a whole-scale newsletter to start to get the word out about the work you're doing. And in this day and age, sort of everyone is their own self-promoter when it comes to social media, and that, again, if you don't have to be reliant on media outlets for coverage, it really is you're creating your own space for distributing and promoting the work you're doing. So a newsletter can combine both what's going on the ground in your community, and then can pull out coverage or advances, what you've seen happening in the larger community and around the country, whether it's a roundup of links to news articles, or a link to a speech or a photo. So these are just two. There's a couple of, RX Safe Marin is doing, has a regular newsletter, San Diego as well. And I would mention, you also don't need to be hemmed in with, we have a weekly or a monthly newsletter and I don't have something this month. It could be quarterly. It could be as needed. And you can start to build your list, start with a coalition. You have a little bit of a butterfly effect possibility with your coalition, and that sort of phone tree idea of everyone who's a part of your coalition, if they're sharing it out, pretty soon that can help to build your lists. And I would mention that on your emails or newsletters, just always have a place for people to get involved, that call to action where they can either email or find out more about joining the coalition work. So here are a couple of flyers. I just mentioned RX Safe Marin, and they put together these flyers on managing pain, and I highlight them for a couple of reasons. They are effective in that they're, again, very visual. They are speaking to patients in the ways, on the left, myth versus facts, consider your options. It's not, I'm telling you this is how it is. It's you hear about the myths, hear about the facts, and you decide. Be in control of your body, emotions, and health. And on the right, I mean, most literally about your body and knowing the risks and really educating people through short little phrases and bits of information that really can resonate as people read them and understand how it affects them. I also highlight this as an example of the power of this coalition work and of people who have come before and have started this work and are deep in it. RX Safe Marin has made these materials available to everyone, and several counties have adapted them. And that's there when you don't feel like you don't have to start from scratch and can create materials. That can be a tremendous weight where you don't have to figure out design, and you can use something that works. And we encourage you to use what works and to modify it in a way that will work and resonate with your community. So brochures are another way to spread the word about your work. This is SafeMed LA, the Los Angeles Coalition. And this is a front-back brochure, and sometimes you have a lot to pack into. You want to give everyone an overview, and you have that one shot to hand things out. And you can have go the brochure route or kind of the two-pager, a front and a back, and having those available at any sort of events or meetings, the kind of calling card that tells people about the work and also invites them to get involved. So you'll see here that SafeMed LA, they have clear sections where they're talking through the coalition structure, how to join the coalition, what some of the stats are, and giving us a couple of visuals, and what the goals are. I mean, there's a reference to the strategic plan and what the goal is: reduce prescription drug abuse deaths by 20% over the 5-year course of the plan. That's clear. And there's reference to the plan, but you'll see on the back in the joining the coalition, or on the front as it looks like next to the SafeMed LA cover page, it says view the full strategic plan at this link. So one thing that I reference here is that you don't have to do absolutely everything on 2 pages. You can link away, you can reference something, and people can learn more elsewhere. Okay. I know I'm rolling through these, so please, if you want me to go back or stop or explain anything, feel free to ask. Surveys and polling. So when you think about your target audiences and you think about who you're trying to reach in your coalition work, by the definition of these coalitions, they're local. California is a diverse state with a lot of diverse needs and conditions within that unique to an area. So you want to speak to your community members. You want to speak to law enforcement in your community. You want to speak to the providers where you live. So what you can do is you can do some of your own surveying and polling, and then publish those results. And that really, so RxSafe Marin on the left, they did a provider survey, and then they went ahead and took that data and they're highlighting the results. And this is speaking specifically to their community. Northern Sierra right now is doing a community prescription use survey. And they even have, there's the survey, and they have a QR code on their materials, which means you can scan your smartphone over the code and then take the survey that way. So when they have those results will speak specifically to the challenges in Northern Sierra. So that's a great way of really speaking directly to a target audience in your community. A couple of other slides of different types of strategies and materials. So you can offer up data points. This is from this SafeMed LA website of Knowing the Risk. There's a scroll, a carousel of statistics and facts about opioid use, some specific to Los Angeles, some broader, that kind of draw people into, again, anecdotes. And this gets into some of what we haven't seen so much in a lot of these materials is that storytelling piece that specifically how it's affecting individuals. So we'll want to talk through that as well in a little bit. And then there's an FAQ here. So sometimes communications materials you think of as, what am I putting on my website? What am I, what do I say on social media? What does my brochure look like? Communications and what is internal to your coalition and how you talk to one another, what sort of anticipated questions and answers you might put together that the coalition has for anyone who asks them about the coalition work can be invaluable. And you just share that around. You're talking with the same language. Someone has thought through, oh, you thought through, and this is an example of as more and more data is being released, we handed to coalitions, here's a run through of different questions and questions that may come up about the data. Here's limitations. Here's where the data comes from. Here's what it tells us. And having that available for your coalition to review, and having everyone feel like they're using language that people feel like is the most compelling and really covers the issue and that are most important to the coalition can be invaluable. So here's a Humboldt list that they put together, and the target audience for this is top 10 things you can do to treat pain more safely and effectively. So they put this together, and it's patient focused, and they've put together a bunch of materials that are really speaking to patients and explaining why these changes have happened, and really anticipating and acknowledging that there's levels of fear that on the part of the public, wanting to know what this means for pain management, what change in policy and practice mean for change in pain management. So here, it's great having a list, having top 10 things. People like top 10, or having a list of 3. Having simple headers, you do want to do that in your materials. Just have something that's bold, that's simple, and using action statements. You could, all of this didn't fit on one slide. There's so much detail, and there's a lot for people to absorb, and a lot is being communicated. So what you can do is you can think about bullet pointing some of your answers, so where they almost read as phrases. Where someone may be able to, they may read 5 of the bullet points, and 2 of them really, that's what they kind of take home with them, or that's, they really feel like that resonates with them. And you could include, any sort of data or images as well. When you're thinking about distribution for something like this, Ideally, it does fit on one page, or it's something that you want to think. Distribution almost, the first step is getting it to someone, and then it's them reading it and them engaging with it and potentially sharing it. So something that's a page, something that can be posted on Facebook as a status update, that people could share around. So in this case, you could actually have a kind of abridged version that's kind of the top 5, and then it almost fits as sort of a square that you could share around that has the main bullet points in it, and then that could be something that could move around a little more quickly. And then you could also, for audiences where you can put something in front of them, you could give them something more in depth. Chronic pain patients, you're handing them something that they'll really appreciate as, oh, you've really put all this thought into it, and here's information I can take with me. So speaking of the 10 facts, I have a few more examples of materials people have used and different distribution strategies, but there are some useful frames that we've seen in these materials that I've run through that you can, as you're putting together materials, consider. You don't have to just, you can figure out ways to construct your messages to where you're either maybe you're answering a question. Did you know? Here are 10 facts. The fact versus myth construct. Here's what's happening where you live. They're setting up a what if this happened, kind of a what if scenario. The FAQs, sometimes it's a who, what, when, where, and why. So if you guys have been trying these, and these can sometimes help in framing your messages. Okay. Okay. So I'm going to talk a little bit about videos and some of the videos that have been made by the coalition, and some that are just out there for general use. And this segues a little bit into what we're talking about when we're coming back to communications for change. What we're looking for is really that data and evidence plus that storytelling, that aspect of here's why it matters to you, that emotion, that there are people here, there's families, there's people's lives. It's not just about prescriptions and cures data and overdose numbers or naloxone kits. So what you want to do, and videos obviously is a way to capture those stories, and there's other ways, but we've seen in the materials previous a lot of data, a lot of evidence, and not necessarily an emphasis on here are the people, here's the face, and here are the people that are affected and their story. So you want to find ways to combine those. So these examples, these video examples, we have Joe Greaves from Alameda Contra Costa County, coalition lead, and the executive director of the Medical Association there. So in reaching a target audience, you can think, well, do we already have ready footage where a peer is talking through the issues, and use that. So it may have shown up on ABC News on a given night in 2015 or 2016, but that can be repurposed and that can be used in materials, and is really a peer talking to a peer. And in the same way, Ronit Lev from San Diego talking about buprenorphine prescribing, and a 2-minute clip of her speaking directly to other doctors talking about the value of MAT is an example of how you target specific audiences with the messengers who they trust. And a couple of these others are Consumer Reports has a range of materials that are available, that are videos and other materials talking about that will walk consumers through the dangers and the alternatives in pain management. And then there's sometimes with a subject that's weighty and overwhelming and challenging, sometimes using animation, graphics can really help tackle something that's pretty severe and heartrending in a way that doesn't completely overwhelm you. And you might end up sharing it or getting drawn further into it because of that animation or because of that design approach. So that's in reference to that, the teen's drug abuse story. And all these materials are actually available in our asset library that I mentioned as well on the shared Google Drive for the coalition. If there's anyone on the call who's not part of, it doesn't have access to that, feel free to contact me and I'm happy to help you access anything you've seen here. Okay. On the personal storytelling, I have a couple examples here. You probably, people on this call probably recognize both of them. Debbie and the quote-unquote Debbie campaign is in reference to anti-tobacco campaign of a decade and a half or so ago. And she became really the face of anti-smoking. And she really, her story really moved the needle on people feeling like I've seen what smoking can do to somebody, and that's enough for me to take action. And really, the evaluations that were done on this advertising campaign showed that people shifted both their habits and also their support of tobacco tax, and really saw the need for a shift based on really seeing this personal story. So you want that personal storytelling element that's gonna resonate with people, and that's really the genuine voice of your community, the genuine voice that's turning what is data and evidence and research into what matters and you know, why it's important. So April Rivero, who I'm sure most of you know of, she's a national advocate and also a local coalition member. This is her speaking at a Fed Up rally last year in Washington, D.C. And you have both video options, and then even from video, you know, her quote just from this clip was, "One person can make a difference. All of us can make a real difference." So you can have video clips where you can show someone, and then you can use a quote from that clip and put it in your materials, and kind of repurpose some of whatever you have that is either video form or audio, and use it in across different platforms. And another storytelling plug and ways to spread the word about the coalition work is to solicit input and feedback from the coalition itself. Some of the hard work of storytelling is getting access to the people who are affected by an issue, and so that's not a hard part for the coalition, because you've done that hard work. You've gathered coalitions together of a range of stakeholders, and now you have the opportunity to ask them and to bring in their perspectives, and then you can use those as well in your materials. So I'm going to talk through a little bit about messengers and methods. We've been through materials, and you have materials you feel good about. It could be that people aren't moved to action, and they may read something but not feel moved because of who's delivering that message and how it's presented. So let's talk a little bit about the who and how. So with coalitions, we've talked about the range of stakeholders, and what message you deliver to, say, hospitals and health plans could be really different from that parents of teen athletes here, say, or the public health community. So you want to think about who the messengers are for different audiences. So who's trusted by a given community? We touched on this earlier. Who are the notables and quotables that the media sees as spokespeople? If you have someone who's talking to a peer or someone who's recognized as respected, that immediately gives them the kind of credibility and the understanding that what they're saying is of value. And it may be that in terms of what you do once you identify those messengers, it may be that they have brochures they're carrying around, or you have a card-sized descriptor of your coalition, or they can spout off the web address, when they're talking about the coalition work and they know the elevator pitch. So it doesn't, you have to go to this conference and speak. It could be, here's some materials and here's 3 lines that we'd like, here's how you can describe the coalition and encourage people to get involved. Some of the methods for distribution. So what are the best ways to reach people? There's, like we talked about, so many these days, everything from door to door, brochures, flyers, where do they go, bus ads, and then a range of social media platforms. Again, you have to think about your audience. So Mendocino County actually has 2 sub-coalitions. They have a rural coastal coalition and an inland coalition. And in working with Waldy and Kyrie in Mendocino County, they're talking about really how we distribute and what kind of methods we use, totally different on the coast than even inland, even within the same county. You have people who don't want to use their computers and don't want a digital access. So having a social media campaign on coastal Mendocino is not going to work. Isn't an effective method. So it's really knowing your area and figuring out and knowing your audience and figuring out what will reach them. And you want to keep in mind that traditional media is not to be discounted. As we talked about, it's not the only way, but you certainly want to build out a list of local media contacts, any specialty industry publications. We have in the media tracking that we're doing in support of the coalition work, we have a list of reporters who have covered this issue statewide, which you have access to, or I'm happy to share with you again. So you can have, and from looking at your own publications, local publications, who's writing about this, who cares about it, call them up, email them with but it doesn't have to be that there's a press event coming up. It may be, I want you to, have someone I want you to meet. I have a doctor I want you to meet. I want you to meet this family. I want you to come in and, can I talk to you for half an hour about the coalition work? Some of both, and you're talking to them both about the issues and the challenges that the community is facing, but also the progress being made. Media wants the good news, the stories of progress and the solutions that you all are in the middle of working through, and there's a lot of stories to be told. So if anyone has any thoughts about methods that have worked for you, or where you get the least traction, this article here is from Managed Care and was covered from last month in Monterey County, highlighting the opioid prescriptions down by half and recurring ED visits down by 60%. So getting actual coverage and then using this sorts of coverage from traditional media and then highlighting that on social media and continuing to point to coalition wins. It doesn't just have to be on June 1st we were able to promote our work. You can kind of continue to re-promote it ongoing. So another traditional media, strategy is having newspaper inserts, and these aren't free, but it's certainly a way to spread the word and to be able to go in depth on an issue. So oftentimes, either if there's an article or you do get an op-ed placed in a paper, maybe it's only 500 words, or the reporter did extensive interviews but only a few quotes made it in, or someone didn't make it in entirely, or they didn't quite get right the framing that how you would frame what's going on in your community. You do an insert, you have the opportunity to go in depth and to really frame the issue. And a couple of our counties have done this. This is Santa Clara County and Alameda County on the right, who have both done inserts. And again, they're not free, and they're not, it's something that can be useful, and there's templates and models you can use, but it helps when you're trying to reach when you have a local audience of media consumers that you're trying to reach, and you can craft that message. So social media, obviously, certainly another way, especially where many of you don't have dedicated communications support within the coalition, social media is a relatively low investment way to get content up onto either Twitter or Facebook or Instagram. I'll point to Instagram being a place where people don't always think of, well, what would I put on there that's relevant to the work we're doing? Well, that's really a place where you can do that personal storytelling, because there's, here there's this Time report on the price of relief, where you're pairing a story, a real individual. This is the impact. It's not about pills and prescriptions. It's about people, and you can tell a little story with text and then have a photo. And how you think about promotion and distribution there is you have a hashtag and you use opioid epidemic, or SafeRx, or managing pain. You can think through different hashtags, and then, or on the occasion of like RX Take Back Day or different timed events, you can use hashtags where people not only throughout the state but around the country are paying attention, can pick up on the stories that are local to your community. And one other thing I'll say about Instagram and Twitter and some of these social media platforms is not just, in an area, you may not use those in an area, say, where people aren't engaged digitally, but you also want to think just about the audiences where it would resonate. It may be that Instagram works with teenagers or families that you're trying to reach. You're trying to talk with them about their options. So there are, different social media platforms have kind of a profile of who might engage with them. Let me make sure I'm not missing any other questions. Yeah. So Facebook. Facebook obviously is a tremendous driver of shaping how people think about issues, and has a lot of information on it, but it's also a place where you can get into the conversation. So SafeRx, Santa Cruz County Opioid Safety Coalition, created a Facebook page. They're populating it not just with, here's something we made and here's exactly what Santa Cruz County is doing, but here's what we're seeing in the news. Here's how we're thinking about this. And Facebook's a low entry way of every couple days you can put a new post in there, and they're building and growing an audience that way, not just coalition members, but people who are coming and saying, oh, I'll stick around, I'll like this page and see what they have to say. And actually Pam Conley from Santa Cruz is testing out some boosted posts, and you can pick specific words. You can pick specific posts and have people who are interested in their opioid safety or whatever keywords, and have them see your post, and that can translate into likes as well. Okay, so we have a couple questions coming in, and I know I only have a few more slides and a few more minutes, so let's see what these questions are. So Della Lisi says, using our members' listservs and their social media works well for us. So absolutely, members are your treasure trove and resource, and the kind of networks that are already built. And that could be their social media channels, their listservs, whatever communities or associations they're a part of. Definitely having ready-made, hey, can you share this? And maybe it's an attachment, and you could have a PDF, you can have it inline in an email, and people can share it in a variety of ways. And then Joe Greaves, who we saw up on the screen here, asks from Alameda Contra Costa, we've been trying to get some earned coverage of some of the good work happening in our community, ED guidelines, the work of various medical groups, efforts within the safety net. And I've not had any luck getting stories picked up. We tried to get coverage. We got a call from a reporter who wanted to focus on the EDs in the Bay Area who are not following the guidelines. Any suggestions on getting traction with reporters on positive stories? Yeah, that is show me the bad news. It's ironic because there is a real desire on the part of reporters, and I'm actually in a former life was a reporter, to be able to, and by audiences, to hear what the solutions are and not just be deluged with bad news. But oftentimes there's a push for, well, the hook being, here's the news, is that someone's not complying, or here's what's wrong. And I think there's a way to talk about, well, we know what's wrong and we get hit with that all the time, and that can be a piece of it, but really showing the how we're gaining traction and how that's translating into a real shift at the community level. But it's definitely a challenge. Part of it is building a relationship with the reporter. I mean, Joe, I'd encourage you to sit down with her or him and have a conversation about the work. And other things can tease out. So maybe it's not the ED guidelines that is in the press release, but they say, oh, well, maybe I do want to meet that family. That's kind of an unexpected outcome that would really interest our readers. So knowing I only have a couple minutes, let me go through. So I just pointing out a couple of other platforms. You guys know about, you're doing live stories and tackling that platform. There's also Medium. Philly Public Health here is on Medium. You can establish a profile there. It allows responses where people can write responses and can have an ongoing dialogue. Issue is a different platform for creating digital magazines. Live stories we talked about. RX Safe Marin's working on it. This is San Luis Obispo, and they're working on a really dynamic live story, and a lot of you are in the work as well. So then you just want to, I think you want to evaluate. Refer to your goal metrics, analytics for digital tools, clicks. Some of these platforms have read time, press coverage, pick up by stakeholders, and the growth of the coalition, which really can be a metric for how you're doing. To sum up, you're setting goals, you're identifying audiences, creating materials that will move them, that speak specifically to them. You figure out your messengers and methods, diversify your distribution tactics, share and network. One thing I didn't mention, I'm going back here, I only have a minute. I loved that Santa Cruz County shared Santa Clara counties. You see on the right here, their posts. We have 30 counties, up to 30 counties now, more than half the state's population in these coalitions. You're powerful together, and sharing the wins, sharing the updates. Those are the kind of cross-pollination that can really amplify your work. So my contact information, please, any comments, questions, let's continue this dialogue. And I'm happy to help. I'm here to help. My email is right here. And upcoming events, we have the Opioid Safety Coalition Fall Convenings in Northern California on September 22nd and Southern California on November 1st. Similar agendas. Sign up for one. You can register at this link. We also will be sending more information out shortly. And thank you for joining. Please take a moment to fill out the evaluation form, and I really appreciate you being on the webinar today.